Hi everyone, I'm Annie Kim. I'm a practicing physician in New York City at Cohen Medical Practice. I'm fellowship trained in minimally invasive gynecologic surgery, so I specialize in benign gynecologic conditions, and I'm here today to talk to you about fibroids. If you're wondering what fibroids are the most common tumor or neoplasm of reproductive age women. They're so common that it's up to 70 to 80% of women under the age of 50, so premenopausal, have them. So you might be wondering what some of the symptoms of fibroids are. They're so common that many women don't have symptoms, but when you do, it can range from heavy bleeding, which is probably one of the most common symptoms, heavy menstrual bleeding, pelvic pain or pressure, and symptoms when the fibroids, due to large size, start to push on other organs in a tight pelvic space, such as the bladder or rectum, causing urinary or GI problems. The treatment for fibroid can vary based on someone's particular age, their fertility goals, so desire for uterine preservation, and symptoms, in addition to someone's overall medical and surgical history. And so also factoring into that is what someone's priorities are for managing their symptoms. So this can be one of four kind of categories. It can be expectant, meaning fibroids are benign. One doesn't need to do anything if it's not causing bad enough symptoms to do an intervention. Then there is medical, interventional, and surgical treatment options. And we can talk about all of those. So the size, the number, and the location of fibroids can affect your symptoms. One of the most common questions I get asked as a gynecologist is how do fibroids affect my fertility and my plans for pregnancy in the future? And so that's a complicated question. Some smaller fibroids or medium-sized fibroids can have no impact on fertility or pregnancy, depending on kind of where they're located. However, fibroids can impact conception by kind of reducing the amount of space in the uterus that's available for a growing pregnancy, changing the uterine lining, or blocking things like the fallopian tubes. Furthermore, the location of the fibroids, kind of the closer it is closer in towards the inside of the cavity, those tend to cause the biggest problems when it comes to conceiving. And then really large fibroids, once you're pregnant, can cause issues by blocking the area where the baby's head comes out or where a cesarean section would be performed. And it can also cause some placental issues if it's interacting with the placenta's ability to attach to the uterus. And then another complication often seen is pain due to the growing uterus and the growing fibroid. Sometimes that can outgrow its blood supply, and sometimes this can lead to preterm pregnancy. So if you or any of your friends or family think they might have fibroids, some of the symptoms that I talked about resonate with you, I'd be happy to see you at Cohen Medical Practice. I am accepting new patients, and we can talk about fibroids for as much as you want.